Okay, Barbara, I think we're ready to roll. We have 34 attendees holding steady, so over to you.
Okay. Good evening, everyone. I'm Barbara Morse, WJAR's Channel 10's health reporter. So happy to be here tonight. Welcome to tonight's panel discussion and Injustice for All, how COVID-19 exposes disparities in healthcare. Now, tonight, we will be hearing from a panel of individuals, many of them graduates of URI and one a professor of nursing. They're each confronting the issue of health disparities in their work as it becomes even clearer during this COVID-19 pandemic. And we'll go into that a little bit more in detail in just a little bit. You'll hear from them about what has happened across the country and right here in Rhode Island. COVID has exacerbated the injustices of our healthcare system. It's actually shown a spotlight on what has been going on for many hundreds of years. Now, before I introduce our panel, let me thank the Rhode Island Executive Office of Health and Human Services Workforce Transformation Program, hope I got that all right, that has funded this panel series through a grant to URI's Interprofessional Education and Practice Initiative. Also, for our audience, we will have a question and answer period. It will be brief because we might go a little long in the question and answer at the end of this discussion, and you'll be able to see that on your screen. So let's get right to it and introduce you to our panelists today. We're going to start with Mario Bueno. Hello, Mario. You can unmute now, or you can stay muted. Mario is the executive director of Progreso Latino. He has a Bachelor of Arts in Economics and Political Science. I need to get this right. Now, Progreso Latino does a lot of things. It's entrenched in the Hispanic community, the Latinx community. Progreso Latino also has a health and wellness program that was established back in 1980, very much needed. And Mario, thank you for being one of our panelists tonight.
Thank you, Barbara.
Let's go to Rosa Sierra. Rosa is a wellness coordinator for Progreso Latino in Central Falls. She received her bachelor degree in public health at Brown University, graduating in 2017, and has dedicated her professional career to working in various sectors ranging from women's health and wellness, marketing, and education. She's an advocate for social justice and focuses on social determinants of health to address health inequity. Thank you for being one of our panelists tonight, Rosa.
Thanks, Barbara.
Let's go to Giselle Bello. Let's look at Giselle's beautiful face here. She's a New York City native, raised in the housing projects of Harlem, daughter of Dominican immigrant parents, and a proud first-generation graduate. Congratulations on that. She earned her bachelor's degree in biological sciences from the University of Rhode Island in 2013, so a fairly recent graduate, right? And returned in 2016 for an informal post-baccalaureate in biochemistry. You're very smart. She is currently an MD candidate, class of 2022. Thank you so much for joining us. We appreciate it, Giselle. Leslie Montague. Hey, Leslie. She works at Rhode Island Hospital. She's a Providence, Rhode Island native, graduated from the University of Rhode Island with her BS and her bachelor's in nursing in 2013, works as a trauma triage nurse at Rhode Island Hospital, which we know is our level 1 trauma center and excruciatingly busy, especially during this entire pandemic. And finally, and I just have to get all my notes together here. You know how you have so many things in front of you that you're like, where am I going with this? Where's my teleprompter? Dr. Diane Martins. Dr. Martins is a professor in the URI College of Nursing. Her teaching, research, and service commitments are to public health, community health, and vulnerable populations. There you are, Dr. Martins. At the University of Rhode Island, Dr. Martins has been a multicultural faculty fellow and interdisciplinary faculty fellow in geriatrics and gerontology, which we know there's such a shortage in that area. Am I right? Absolutely. And we're going to start off with you. You have a little presentation for us.
That's right, Barbara, and thank you for the introduction. And I'm very happy to be with this team of wonderful people representing the community. Let me just get my screen to share. Okay. So welcome to all here today to hear about and all the injustice that we've experienced with COVID-19, as demonstrated through health disparities, not only here in Rhode Island, but across the United States and throughout the world. So to begin here in Rhode Island, we know that the Rhode Island Department of Health has already let us know that we have populations here in Rhode Island that have increased risk of COVID-19. It's a lot of the populations that you're already familiar with in terms of our older adults, particularly older adults with prior medical conditions, and that includes younger adults with medical conditions, our racial and ethnic minorities, people with disabilities, and people experiencing substance use disorder. The Rhode Island Department of Health also reports on some settings that we've seen some increased risk of COVID-19 in those settings. One is actually people living in the rural community. Another is those experiencing homelessness, also those that have resettled and refugee populations. We know about the nursing home and long-term care facilities, and also group homes for people with disabilities. We do know that racial and ethnic minority groups and underserved groups, especially African American, Latinx, and Native American communities, are at increased risk of getting sick and dying from COVID-19. One thing that you'll notice in the literature and that we saw was social determinants of health have contributed tremendously to this inequity with minority groups. It happens to be that this year in 2020, as of August, the US government's Healthy People 2030, in their social determinants of health goal that they only started in the last set of objectives in 2010 for the 2020 outcomes, they added 5 domains to this outcome because they recognize the absolute necessity of addressing social determinants of health when we address health outcomes. The 5 domains that they've added are the economic stability of the person, their educational access and the quality of education they've had, their healthcare access, but also the quality of that healthcare that they do access. They also looked at the neighborhoods that people live in, their zip codes, the built environment, and in that particular domain, they also include whether or not they have access to food, and also the social and community context in terms of networking. The Department of Health here in Rhode Island looked at the cases by race and ethnicity for the population in Rhode Island that developed COVID-19. And you can see on this continuum that the Hispanic or Latino population represented 45% of the cases in Rhode Island. The African American population represented 12%, whereas the white population represented 38%. This is clearly not the same distribution that we have for the population in the state of Rhode Island. Even worse than the cases are the fatalities that occurred here in Rhode Island based on race and ethnicity. We see that 12% of those that developed COVID-19 that were Hispanic or Latino died due to COVID-19 or its complications. 6% of the African American population that developed COVID-19 died from COVID-19, and 81% of the white population. This particular infographic from the Center of Disease Control shows us clearly the distribution of cases, hospitalizations, and death for people across various minority groups. It shows that for those that are American Indian, Alaskan Native, non-Hispanic persons, they had 2.8 times the number of cases, 5.3 times the number of hospitalizations, and 1.4 times deaths from the average population. This was also seen with slight increases in the Asian and non-Hispanic person, But in the Black population, based on US cases, they had 2.6 times the number of cases in the Black or African American population, 4.7 times hospitalizations, and 2.1 times the cases of death. And for the Hispanic population or Latino population, it was at 2.8% high, 2.8 times higher, 4.6 times higher for hospitalizations, and 1.1 times higher for deaths. Economic hardships were also documented during COVID-19, with people talking about whether or not they have been able to pay for basic necessities such as food or heat or rent. And we can see that the white population is represented by the aqua, the Black non-Latino population is represented by the navy blue, and Latino population is represented by the tan. And we can see that across the board, whether it's been able to pay for basic necessities like food, heat, or rent, or used up most of their savings, or borrowed money, or taken it out for a loan, or suffered from any other economic consequences, there's clearly an increase in the minority populations. According to Johns Hopkins School of Medicine report by Golden, they looked at risk factors of people of color, and those risk factors go back to the social determinants of health, including crowded living conditions, housing conditions, working in the essential fields of healthcare, inconsistent access to healthcare, other chronic health conditions, and we know chronic health conditions are increased in populations that have greater difficulty with the social determinants of health, as well as stress and immunity that also an impact on the immunity, which occurs when people have stress due to racism or other kinds of isms in our society. Another article that looked at COVID-19 and social determinants of health was done by Rollston and Galea. And in this article, adults with social determinants of health risk factors, they found were more vulnerable to COVID-19 because of the neighborhood they lived in and housing. We saw this when we saw the news reports every week during the beginning of COVID-19 in the United States. We began to see it in New York City. We saw it in the Queens area near Elmhurst Hospital. We began to look at neighborhoods, housing, income in those areas, poverty levels, food accessibility, educational level. People's ability to work remotely is clearly defined by some of those educational activities, pre-activities in terms of social determinants, as well as their income level. Transportation, those with that struggle more financially have to use more public transportation. Race and ethnicity also predicted increased episodes, as we know, of COVID-19, illness and death, as well as difficulty with accessing healthcare. And then I end with this, which is just the tree I love because it gives us options of how to help people through things like COVID-19 in ways that we don't normally think about with more traditional Western medical models. Thank you.
Thank you, Dr. Martins. Little eye-opening there. I want to go beyond the numbers though right now, and I'm going to start with Mario Bueno. When this pandemic struck, what were you seeing, and what have you seen evolve since March in the Hispanic community?
Well, at the beginning, we were receiving calls from medical professionals dealing with the crisis head on, and I was getting calls from them, Amy Nunn from the Public Health Institute at Brown and other folks, and saying, hey, is the community aware that they're, disproportionately being affected because we're seeing them in the hospital? And I think that the governor understood and her administration the importance of conveying this to the community. And at the beginning, what we discussed and what happened was getting the message out in multiple languages through the ethnic media that's available. and just getting the message out that, this is a serious issue and that you need to be aware. At the beginning, the problem was that the public message was focused on social distancing outside, when the problem was not outside. The problem was, how do you social distance in your own home?
Mm-hmm.
And I think that was the message that was not getting out and is finally starting to get out now. So I think that was a big concern. And it was something that we were advocating for here at Progresso. We were part of the Beat COVID campaign between the both cities, Central Falls and Pawtucket. Dr. Fine was part of that. And he was instrumental, given that he's a physician and very outspoken and was part of the health department at one point, at thinking about creative ways. How can we be more effective in terms of not only getting the message out, but all of us contributing towards being safer? And he started the 7 Mask campaign. So we have a senior program here at Progresso Latino, and we have our senior citizens, older adults. And since COVID hit, they've been making masks on a large scale and giving masks out to family members and people in the community. So, it's been an experience. We have been involved. Some of our basic needs programs at Progresso have, quintupled in size because the need is so great. And we're humbled by having this opportunity to help, but we're also very saddened by the fact that the Latino community and other minorities communities have been disproportionately affected.
A part of the problem in our Black and Brown communities is a lot of us in those communities are working jobs where you have to show up during a pandemic. They're usually low-paying jobs. You're living in tenements. There are things that you really can't control for. And do you think we've made progress in that area? What do we need to do?
That's a long-term effort. Each administration, not only the current administration for the state and our legislators, all speak to the fact that we need to upskill the workforce, and so that workers could make a living wage and that they could, work in different areas. One being healthcare, for example. There is a dearth of medical professionals, behavioral health professionals that speak multiple languages, and that's always been a challenge for us in the community. So it is what it is. When the manufacturing sector caved and moved out to China and to other countries, hospitality took its place for the immigrant community, and that's one of the high-risk sectors. So a lot of the folks in our community, they're working in restaurants and other places, and these companies have been the hardest hit, as you know, because many of them have closed due to COVID. So it's been a very difficult situation for the community. There are many people that are out of work. And we're cognizant that there are folks living in the shadows that are undocumented, do not receive any support from government, and need our help in the community. So that's a challenge as well, because they're part of the fabric of our community and need our support as well.
And Rosie, you work for Progresso Latino. Have you seen things improve in the last 7 months? What are you seeing?
So I will be transparent that I'm a newer around Progresso Latino, but I think that at least, in regards to the basics, mask usage and the sanitizing, I think that there has been a stronger effort there. But as Mario mentioned regarding the basic needs, kind of the social infrastructure and support that's necessary to carry people through the pandemic, being able to have residual income or time off if they are sick. There's a lot of fear behind getting sick and tested that I think we're starting to tackle now as, solutions to COVID and interventions around creating a vaccine is at the forefront. So I think the messaging around figuring out how people do care for themselves if they come across COVID, in addition to prevention, is what we're seeing hopefully improve.
And Giselle, you're from New York City. Are you there now? Were you there at any point during the pandemic?
So I am currently here in New York City in the home where I grew up in the projects of Harlem. But I was still in my third year of medical school when the pandemic hit. And so I was in Rhode Island and I got to safely quarantine with my partner in Central Falls.
You have family still in New York?
All of my family is in New York. I'm the
Very
only
scary
person.
time. You were the hardest hit for the longest period of time. And we saw the minority communities just disproportionately hit.
Absolutely. I think that, you know, I spent a lot of time worrying about my mom and my family, specifically because my mom still does live where we grew up here in the projects, where, you know, there's 500, 600, 700 families that live in one building at the same time. And also families that are getting all different kinds of information, which I think that has been what has added an extra layer to the disproportion aspect for communities of color. I think that if I pull up my WhatsApp right now, like the amount of messages that I've gotten about, using a mask and having the mask on for too long is actually bad for you, or like it's the 5G that made this coronavirus happen. And so I think that there was an added layer of misinformation that unfortunately also affected our communities of color. But I was also really nervous for my dad, who is a renal transplant recipient and on immunosuppressants, and also, an Uber driver. So a person that it was essential to the community, but now was on the top of the list of the people that if he got COVID, I mean, he was, gonna not make it. So yes, it was an absolutely scary time. Unfortunately, my partner did lose one of his uncles who lived here in New York City. And that was a complete shock,
Yeah, it's tough when I lost my dad to COVID, African-American man. So I totally get, what's going on out there. It's really tough, but I want to go over to Leslie, because you're in the trenches and you've been in the trenches since this struck, and they closed Rhode Island Hospital and all of our hospitals to visitors. And what was it like? And how did your training at URI kind of help you just dig in, and go to work and try and help save lives?
So it was definitely hard, especially with like the no visitor policy, especially in the beginning of the pandemic. We weren't getting any visitors at all. And working in trauma, you were dealing with life and death back there. And a lot of the times my patients wouldn't be doing so well. And the only way to for their loved ones to communicate with them was to put a phone to their ear. And that was hard. That was definitely hard to deal with. And like, I remember a specific patient, they were nonverbal and they were like almost at like end of life. And the daughter had called and I said, she can still hear you. I know. I put the phone to her ear and like tears fell down her face. And it just meant everything to that daughter too. And it helped them cope with the stress and not being able to see their loved ones in the hospital. It was hard, very, very hard.
How did you help protect yourself and others? There was a fear of going to the hospital for many months, and I did those stories. It's not safe to go, even though we knew there were COVID units,
So
Go ahead.
I feel that a lot of the times too, a lot of patients, because of that fear of COVID and going to seeing their doctors or going into the hospitals, they were like stopping themselves for receiving treatment. So by the time they did come into the hospital, they were very, very, very sick. And then on top of saying if they did have COVID, it was just a domino effect. But I did see a lot of patients waiting to come in until like they were just really, really, really sick. So it was hard.
And how is it now? I mean, I know we're gearing up for a resurgence.
Mm-hmm.
But how is it now? You feel prepared?
I feel like we're a lot more prepared than we were in the beginning. It was a lot of changes. Policies were constantly changing in the hospital, like day to day, and it raised a lot of stress and anxiety for the workers. Because one day, like the N95 mask would be perfect for us, and then the next day, oh, we need goggles and hair masks, hair nets now because it can live on your hair and eyelashes. So then it raised stress for us because now we're like, the day before, like, are we gonna get like contract COVID now because we didn't have the goggles and the hair net? So it raised a lot of anxiety, but it did calm down. It has calmed down, but we're starting to see it come back up again. So I do feel like we are gonna hit that second surge.
And I want to talk to some of the barriers to even seeking out healthcare. There's not a lot of people of color who are in the nursing and in the healthcare professional arena. And Dr. Martins, I know you have a program at URI called Pathways to Nursing. And how do you hope that makes a difference? It's not enough to say we need more Black and brown people in the healthcare field. How do we actually ensure that's going to happen?
We definitely need more of my minority population in general in healthcare. It will make our patients more comfortable. It'll make the population more comfortable. There's a connection that when you see people like yourself going into healthcare, there's a higher level of comfort and less stress when you can identify with that person. We have been clearly have a huge issue in nursing and medicine and many of our healthcare professional fields with not having enough people of minority backgrounds. At URI, we have established not only talent development, which is a wonderful program, that's across all programs, not only for the health professional programs, but in nursing, we have a grant that came through HRSA to establish that where we were able to establish a program called Pathways. And Pathways intentionally starts to recruit students at the high school level, although I believe it should be at the middle school level. It needs to start very early so that you can give them that corridor. I know Brown University has the same, and maybe Giselle will be talking about that later, I think it's called the Pipeway or something, but she can speak to it. But these pathways, first of all, if there's any discrepancies in terms of educational levels within our school systems, which last summer, we know in summer of 19, Johns Hopkins University did a report on our Providence school system, which was clearly not favorable. So if a student graduates from one of the schools that they were referring to, and then tries to go to the university or to another college, that is not fair because their background in biology or chemistry or anatomy is not going to be giving them the fighting chance that they need to start college. So these pathway programs and talent development allow students to start the summer before school begins. And they also include they have laptops that are involved. They do an orientation with the families because we know that the families that come from minority backgrounds, many of them some of them are lower income. They depend a lot on that particular child who's going away to college to help them out with bills and doctor's appointments and all those things. And so they're leaving, but yet they're calling them every day saying, can you come look at this? Or can you check on this? And it's such a pull on them because they love their family so much, but at the same time, they want to accomplish this goal. So Pathways not only orients the students, but also spends time talking to the parents about the importance of allowing them to focus on school, but also by the school reaching out to the parents and guardians to say, what can we do to help you now that they need to be focusing on school?
I want to go back to Mario and Rosa. Mm-hmm. Is this something that Progreso Latino can help get out to? I mean, I don't know how far your reach is, Dr. Martins. Mm-hmm. You have to have tentacles everywhere to really reach a lot of these places. Any thoughts, Mario or Rosa, and even Giselle, on how we further this reach and get more Black and brown people involved in the healthcare movement, which I think will go a ways in breaking down some of these barriers to getting the healthcare you need.
Yes, I agree with Diane that a lot more has to be done. And this is not just in the healthcare sector, this is in education, this is in every important sector that touches the community. Unfortunately, we haven't learned from prior generations, waves of immigrants that have come in the past. We always talk about how, hey, we are developing over time and we are progressing, but it is very slow. And a lot of the progress that we've made, we forget as new generations come in, it's like starting all over again. And unfortunately, that's the experience that we have. I know, Barbara, you've heard it over and over again, but we have foreign-born professionals who are here who have worked in the healthcare sector and other sectors, but they come here and they have humongous barriers of entry to come into. If we were able as a system, as a community and in different fields to lower those barriers so that people in the community can participate in the economy that they pay for and that they're served by. Unfortunately, it's just difficult to do. So programs like the one Diane mentioned are really important. They do touch a part of our community, and we need to continue to strive for an equitable system where higher education is more equitable and people of color have more access. And equity means, if you didn't get strong math skills when you were in high school because you went to a public high school in Rhode Island, then let's see how we could get you up there so that you can enter the field. But the system right now is it's a pass-fail system. If you can't pass that test to get into nursing school, by the way, which has many long lines to get in, then you can't get in. It's the top of that get in. So the system needs a lot of work.
I'm so glad you brought up equity, because there's a difference between equality and equity.
Yep. And it's not an equitable system.
Right.
And we would love for it to be, but unfortunately it's not.
And Rosa, any thoughts on that?
Yeah, I guess I would second that by saying education is incredibly important, but representation is as well. So to have young folk be able to look at individuals who look just like them being in positions of power, be that as medical professionals or, Mario and I talked recently about, the individuals who sit on boards who control policy change within hospital systems, trying to influence that kind of behind the scenes as community organizations and putting a little bit of pressure on institutions to be more diverse in their representation, I think can help start that cycle of representation and having our youth look up to folks and want to be like them and see that as an opportunity in their future.
But isn't part of the problem retention? I was talking to the fairly new Chief Diversity Officer at Care New England, and it's not even so much getting people in, but it's retaining them. There's racism within the walls of organizations, and people just say, I'm not going to deal with this anymore. So, I see Giselle's nodding her head.
Mm-hmm. So there have been so many things that y'all have touched upon that I also want to say my piece on. I think to get to what you just said, Barbara, absolutely retention is one of the things that is difficult, because you can get someone all the way through. I know we think of it as the idea of a pipeline, right? But me as a Afro-Dominicana who grew up in Harlem that has all of these layers to who she is, you can't just pick part of me, put me through a pipeline and expect me to be, this person on the other side, because what the pipe is missing is all of that nuance of what actually informs my decision to even be a medical professional. And there's no way to disentangle who I am and what I'm bringing to the table from me becoming a doctor. And so I think that these programs are wonderful. I myself participated in some of these programs in New York City, and they were instrumental to getting me to where I am right now. But also there is part of sort of wanting to have people split themselves and like forget about the fact that their family is calling them to ask them to translate this thing, because Diane was mentioning that and I was shaking my head a lot, because that literally is the story of my life. Like, I still tell my mom that she thinks that I'm her personal secretary because I like have to be, you know, as children of immigrants, like we are the bridge between the United States and our families and our cultures. And so with regards to there being like racism in the walls, I was just having a conversation with my friend today, who's actually a medical resident here at New York Presbyterian, who's also a Black woman. And we were saying that the reason why there's such inequity is because during the times in which medicine was created, we weren't equal. Like, we weren't the people that we are right now when medicine was gearing up to make all of these innovations. And so we can't function on those same structures that had Marion Sims practice gynecological procedures on Black slave women and also say, oh, but we're doing our best, it's all good, you know? So obviously this is something that I'm very passionate about. I'm currently the Diversity, Equity, and Inclusion Fellow at Brown for the medical school because this is one of my biggest passions. I think that absolutely having more diverse populations in the medical field is going to help the population. And you know, so much so that one of the things that I did at URI was start the organization Seeds of Success, which is to help students of color who are interested in medicine, not necessarily with the academic component, but to find someone that they can vent with, because this is a very lonely road. And if you don't have people, you know, like I love to say, my village, like right behind me, there's no way that I would have been here like right now. So.
Yeah, you brought up some.
About it forever, but.
Oh no, I mean, we all have our soapboxes, right?
Yeah.
I come from a long line of preachers, so don't get me started.
Right.
Let's go back to Leslie, because you're actually in the thick of things as a healthcare professional. Do you, what are your thoughts on health inequities? What's going on in the hospital? Do you feel it's diverse enough? Throw a whole bunch of stuff at you, see what sticks.
I feel like there's always improvement for diversity within the hospital, but I feel like Rhode Island Hospital does a pretty good job, especially like I'm very proud to say that I'm a minority nurse, especially given that I have the opportunity to work at Rhode Island Hospital, which is in the center of Southside Providence, Rhode Island. So we do get a lot of diverse patients, and I feel like as a minority nurse, a lot of my patients can relate to me and maybe understand me a little bit better. And sometimes I can kind of like get rid of that medical jargon with them and kind of like explain things and what things mean and help educate the population. And that's my way of giving back to my community, is by working at Rhode Island Hospital. And bringing TD back up, I was a proud member of talent development at URI. And if it wasn't for that program, I don't think I would be like a nurse right now. My SAT scores, I was never a good test taker. It always made me nervous. And because of that grade, it probably I wouldn't have maybe gotten into the nursing program, but because of TD, they guided me and they had such great like resources for us. And obviously we had to like maintain like a certain grade, but if it wasn't for that program, I don't think I'd be in the medical field at all.
And I think Giselle brought up a good point. I'm going to go back to Giselle. You know, you have family calling you, asking questions. You're trying to work, but you also have your commitment to your family. And this happens a lot in the community. You might be babysitting for, you know, a younger brother or sister, or your mom's got to run out. You have to do that. There's so many things dragging at you. How do you make it all work?
That is a daily question. I think having people that have been able to be a mirror for me has been very important. People that know, you know, my commitment to medicine and like my passions, and also know how committed to my family I am, and can like look at me when I'm going through some sort of issue or having to find a logistical solution and say, okay, you're playing yourself. Like, you actually need to focus on this. Like, your family's gonna be okay. Or can say the opposite, right? That it's like, okay, but you have some time before this exam, so maybe you can help out with this thing with your family. I think I have been very lucky because I have wonderful friends that have been able to keep me accountable with that, and also like having my partner, you know, really be a mirror to me and just always say like, okay, I know you're gonna want to get into this before I even process it in my mind. He's like, I know you want to get into this, but like, I think you shouldn't, right? So I think for me, it's been absolutely instrumental. And I think it is the way, not only for me, I don't think that my story is unique. I think that it is instrumental for students to have a community of people that can lift them up when they don't believe in themselves, that can, you know, kick in the door and like help them come through. I know that I always mention it, but like I would never, ever, ever had such a big world view if it wasn't for my first mentor, who, you know, worked at Goldman Sachs and would take me out to lunch at different places, like different cuisines, but it had to be a place that she had traveled to before so that she could tell me stories about her travel. You know, like I would have thought life was this block, you know, like my neighborhood. And that's why mentoring is something that's so absolutely important to me, and I think to everyone.
It absolutely is. And I do want to bring up the Black Lives Matter movement, because in my opinion, and anyone can just come in on this conversation, I feel like that is what shone the spotlight on the health disparities and disparities across the board.
So I was thinking about this question actually, because I feel like even when we make the effort to bring more students of color into medicine and diversify, you know, like the healthcare field, there is still such a lag that happens for like the hospital systems to sort of pick up the motion and get with the times. And so, you know, to me, it is blatantly clear how Black Lives Matters completely overlaps with the care of my patients and the disparities that they're having and the inequitable access to care and all of that. But at the hospitals, like, we're not having conversations like these. We're not having conversations that, at least not deep enough conversations to actually have people pry people's eyes open for them to be able to connect the two things that are happening, for them to be able to connect the continuous murders of Black bodies that have been happening with the stressors of their patients, and then therefore the bad outcomes. It's, I mean, not for nothing, but it's the reason why you do need to diversify the medical community, because I can see that clear as day. But, you know, other people have sort of a harder time getting there themselves.
You see what you want to see. Anybody else want to comment on that?
I would like to comment on it if it's okay.
Of course.
Barbara. I do think that Black Lives Matter has given all of us a huge spotlight on structural racism. And that structural racism, I do believe that it has impacted COVID-19 as well. You can see it in the people's fear of going to the hospitals, the crowding in the neighborhoods, the poverty, the racism that people experience when they go to see a provider or they go into a healthcare system, or they're trying to get a sense of, you know, I'm going to wear a mask. When I walk around Providence, I notice that it seems like every person of color has their mask on, even if they're all by themselves on a street. And then I see others that can be walking with a bunch of other business people in the city, and none of them have their masks on, and they're not people of color. And there's like a a sense they know, I think people understand their vulnerability because of the disparities that they've experienced, not only in terms of housing and education and income levels and all the opportunities that that they have not been given full access to. And I do believe it's structural racism. And that's why I am so grateful for the Black Lives Matters movement in general.
And Mario, I'm going to go back to you. I have noticed the same thing, that I see, our Black brothers and sisters out there, Black and brown, tan, out there with masks a lot. So maybe the message is getting out there.
Yes, it is getting out there, but again, the problem is that it's hard to isolate at home. So they may be wearing masks outside, but inside, how do you stay away from your kids? How do you, if you have little ones? So that's kind of like the main issue, and I think the spread is happening and in that arena, and also in the work arena. So,
and the governor spoke to that today about friends and family being the biggest uptick in cases. We're around friends and family all the time. One person gets it, we all get it.
Exactly. So it's really tough to keep distant at home. And I think that's the issue. And unfortunately, when you have two families living in the same apartment, we have to understand how difficult it is. Where rents right now are extremely, extremely high. It's very hard to find an apartment, especially in Central Falls and Pawtucket and Providence. So it's pretty difficult for families. They just can't say, hey, well, we have COVID, so let's split up as a family and let's find another apartment. It's hard to find an apartment. So, folks are stuck where they're stuck, and they have to find solutions for their family. And that's why it's so difficult right now with the hybrid and virtual learning at school. A lot of parents that I know have decided for their kids to do the virtual because they're afraid for their own health. They're afraid because they have chronic diseases, and they're afraid for their own health. So their kids are not going to go to school until this is over.
But then that stops them from working, and then there's no money coming in.
Exactly. It's an issue all the way around. It's a difficult issue, and we're thinking about how to survive and how to make ends meet, and we're being very creative at it. So we're learning new things, and hopefully more people in the community will get together and support one another, develop programming that will support people, new ideas to help people out. But it's a difficult situation, and hopefully we'll have the resiliency to move forward.
I'm going to ask one final question. I want all of you to answer before we open it to questions and answers about the long-term effects of our original COVID response and what we can learn from it, and how do we grow as we are facing a resurgence. And since you're up there already, Mario, do you want to take that?
Well, we have learned a lot, and we have gotten the questions about what to do now. And I think it's simply to maintain the same message, to be an example, and to offer opportunities for people to be creative. We have to be creative. We have to be risk takers, not in a bad sense, but we have to take risks for our community, and we have to think of others, not just ourselves. And I know that's easy to say and it's hard to do, but if you can help someone, get to COVID testing, if you can help someone with some food because they don't have access to food, if you can help someone who's isolated and needs company and needs a phone call. I know a lot of people who are at home, they're stuck at home, or they're stuck in a assisted living situation. They don't have access to their family and friends. And, just making a phone call makes a difference. So I think we understand that, and we have to communicate that, and we have to also cherish and thank people for what they do. And I'm not good at doing that. I don't thank people enough, but our team here who's at the front lines, I don't do enough to thank people here at Progreso Latino, but we should be thankful for those that are helping us and are really care for us. Health professionals, educators, let's find a way that we can somehow symbolically thank those people that are making a difference in the community.
Well, I'm going to go right from that to our first responder, Leslie, who is in the thick of it. And I do want to thank you personally for being in the thick of it. What are your thoughts on this? Have we learned a lot from our COVID response
Yes.
efforts? And what can we take going forward?
I think education is probably going to be like the key factor play in all of this. And what I want from everybody to from this is like prevention. So I look at it as like the 3 W's: wash your hands, wear your mask, and watch your distance. Because if you can, there's some things that you can't prevent, like your age, your genetics. You can't stop those things from happening, because with age, normally your organs naturally decrease in function. So if we can stop things like smoking, eating healthier, wearing your mask, washing your hands, keeping our distance from one another, that will help with the transmission of corona. So I think, like I said, education, I believe, is going to be key, and working together and getting information out to the public. And for me, in the beginning of COVID, when everything was like new, no one knew like how it spread, I had made like a little video about how to properly wear a face mask, because even my family and friends, they weren't wearing the mask properly. They were wearing it upside down underneath their nose. So I had made like a quick little video just to put out to the community, just to educate people, because people just did not know how to simply wear a mask. So I felt that got like a lot of positive reviews on that. So education is key.
And Giselle, you're on the front lines as well, and we appreciate your service. What's your message?
Leslie, I actually saw that video. I think I'm gonna go sort of the opposite way of where this has been going. I think my takeaway from this, mess of the way that COVID was dealt with is that science should not be political. There is nothing that should be political about having science be transmitted equally to all people, no matter what news channel you're watching. That is sort of the point that like I continue to go back to. I think, you can watch the news and see what are the things that have been said about the United States, how we've dealt with this. And I think that is my takeaway. My takeaway is that science should not be political. As, a future physician, I should not question the best standard of care, like based on where I'm getting the information from. So, yeah.
Yes, it is a public health issue, not a political health issue, even though it's become one. Rosa.
Yeah, so drawing from what everybody has spoken about, I would say, drawing comparisons between the Black Lives Matter discussion that we just had and COVID, that we continue forward, not focusing on the symptom, but rather the condition. So, COVID is the illness, or, fatalities are a resultant of all of the inequities and health disparities that our populations are facing. But social determinants of health are determined by someone, a structure, an institution, an organization. And that's kind of the root of the issue that I think has to continue being addressed moving forward. In addition to prevention and education and, depoliticizing the conversation, but ensuring that everybody has the same fighting chance, to deal with what's coming at us. I think that's paramount.
And I want to apologize because I am frozen here, and sometimes that happens. We're in a great big huge studio, but I am still here in voice, and I'm probably making a face in that frozen thing. But I want to get to Dr. Martins on your thoughts on that.
My thoughts on it. Well, first I have to say I absolutely loved every person's input on this, because I think we need it at all levels, the individual level, the structural level. But I think what I've been noticing, being a resident of these United States, is that our national leadership has not been the type that's been recommended globally for those countries that have been successful. We know that countries that have been successful with COVID-19 have had strong national leadership that clearly led the way. And, but we also know that here, we don't have strong national leadership, well, at least not the direction we need, especially as Giselle talks about as science helping us to be strong. But at least at the state level, we've had strong leadership. New York, where you live, Giselle, has had excellent leadership as well. And I'm grateful for the governors that have come through in spite of our lack of national leadership in order to get us through this very serious pandemic.
And we do have a couple of questions, so I'm going to go to those. And again, I apologize that I'm frozen with a smirk on my face. That's the typical Barbara here. But one of our questions is, and you can raise your hand or just start talking, can you talk about how being part of a healthcare team is critical to addressing social determinants of health? Anybody want to field that one?
Question?
Can you talk about how being part of a healthcare team is critical to addressing social determinants of health?
I feel as an interprofessional team is important because sometimes we see a lot of homeless patients at the hospital. So having social work and case management involved and having finding them resources to go to after, because it's hard because they're homeless, so you put them back out into the street and then they're around all these people, and it takes that one person to spread it to everybody. So having them, and they've been such a great help in the hospital when it comes time to discharge these patients. We actually had a place, it's not really in action right now, but we had a resource, a hospital for patients to go to, a hotel for patients to go to quarantine until their symptoms or until they had negative tests. So social work and case management was setting that up for those people in that community. So I thought that was very helpful for everybody.
Too bad we can't do that all the time.
I know.
Then we would cure homelessness
Yes.
too. Another question, what keeps, and any of you can pipe in, what keeps you going despite all the challenges, personal and professional, in doing what you all respectively do?
I think for me, the thing that keeps me going is understanding that before I even had the opportunity to be a medical student, my grandma immigrated to the United States, and before her, her mother had her own little revolution that she waged, and her mother before her. And I think that there's been so much sacrifice that has amounted to me being on this platform right now, right? So my job is going to be to treat people, but really my job is going to be all in my head, is thinking and processing, through differential diagnoses and treatment plans and all of these things. And I get to do that because my grandma decided to come to the United States. I think when days get really, really hard, I love to sort of envision that I'm standing on a platform of all these women that came before me. And so that's something for me that really keeps me energized and moving, because they certainly didn't have the option of quitting, because it was life or death for them. It was always, they were always on survival mode. And so just thinking that my hard day is nothing in comparison to their hard days.
And Mario and Rosa, maybe you can talk about that too. What keeps you going despite all the challenges? You're out in the community. You have personal lives too. You have professional life. Sometimes it can get overwhelming. We all are in the same boat. Sometimes you feel like it's sinking. We have anxiety, we have depression, we have all kinds of things going on. How do you maneuver through all of this and try to help the community?
Barbara, I don't know how I do it.
I can tell you. No, I'm kidding.
It's really difficult. And I'm really inspired by Giselle, Giselle and what she said about her family and her ancestry. And I think that's very important. And I think it's all about community and the village, you know. So I think that's what keeps us going, our hope for a better future. And being inspired by young people like the ones today that are here with us. I think they're an inspiration for us all, because they've struggled and they're still continuing forward, and they're the future of our community. And they inspire me. And I'm hoping that you know, others will be inspired, and that with that hope we could make a change in the community. So it's very difficult. There's always that little devil on the one side of my, you know, ear telling me, what are you doing, you're crazy, you know, go home. But you know, there's those angels, and it's those community members, our board members, our staff, our families that inspire us to move ahead.
And Rosa, I am going to add to that with you, because one more question came in. How do you build trust in the minority communities regarding a COVID-19 vaccine trial or a vaccine? Many of us don't even want to go in for testing. So how much trust are we going to put into a vaccine or vaccine trials even?
Well, we're figuring it out. We're trying to get into those WhatsApp groups and finding out where the trusted, you know, sources of information are coming from, and seeing how we can myth bust and inform. And I think, you know, Mario and our work, everybody's work here, you know, I think we tend to zoom out and we look at it kind of top down. We look at these structures and we look at all the larger conditions that are informing the change we want to make. And really the small victories of just being able to talk to one person and touch one person, I think is both helpful in keeping me going, maybe keeping other people going, but also when we're taking into consideration how we're going to influence and how we're going to make change. It's, yes, there's things on a larger scale, but it's really one person at a time. You know, when someone is saying something erroneous or just completely out of the blue about COVID, you're like, that's not true. Where did you hear that? And you can kind of address it right then and there in such a more powerful and honest way than sharing something on Facebook that is going to be coming at, you know, in the same way that all the other information is coming at you, and you kind of have to dissect it. Most of the people that are trusted are the people in your circle. So if we can continue to be those people that are human and are grounded to the people that we're talking to, I think that will help a lot.
What about building a trust in a vaccine or vaccine trials, participating? We need more minorities taking part in a lot of research.
Yes, exactly. I think having community influencers show that they've been vaccinated and that nothing happened when this does happen, I think is important. So people in the communities that are trusted, if they go out and they say, hey, I went and I got vaccinated, other people will get vaccinated.
Like eventually, just like the flu vaccine for healthcare workers is like a mandatory thing. I feel like the COVID vaccine's gonna become the same, mandatory for us. And I feel like if I do have to get it, and I'm like 50-50 on it right now, but if I do have to get it and I turn out okay, I can relate that to my community and via social media or whatever, getting out there and show I'm safe, I'm okay. But
I noticed some hesitancy there. I noticed some hesitancy there. You're like, if I turn out okay, and this is
like, it's a scary thought. Like, it raises a lot of anxiety, just the thought of it.
Giselle?
I think that you pointed out something that is important, Barbara. I think one of the things that informs the way that I encounter patients and sort of treat and work with them is the fact that it is okay that communities of color don't trust medicine. It is okay. And I think that addressing that, especially because one of the roots of how medicine began, and two, because during different trials and research, the way that Black and Brown people were taken advantage of. I mean, I think addressing that up front and sort of trying to understand what those fears are for people and where they come from and how you can help them through it and make it so that they feel that they are making their own decision and that it's not something that we're influencing them to do, even though we think that they should do something, is paramount. I don't believe in the style, in the like paternalistic style of medicine, and think that it's actually done, some harm, especially to communities of color. And so Leslie's hesitancy is totally fine. And she's even, like we're even in the medical field, right? It's like we should be the champions of these, but also, again, there's these layers that we have to who we are as people that you can't disentangle from the fact that we are healthcare providers. And so addressing that, I think, is very important. It not only lets your patient's guard come down a little bit, but it actually helps them build trust by knowing that you're also thinking about that thing.
But also addressing the need for more minorities to get involved with research, because we are the ones who are going to be treated, and you need to have certain ethnic groups involved. They can't all be Caucasians.
I mean, you can get me on my soapbox about this too. I've read front and back Dorothy Roberts' Fatal Invention. Like, I help teach courses about the importance of having a diverse group of people in research, but also like what exactly does that mean, diverse group, and sort of like what people take from research and how sometimes the research is used for capital gain and all of these things. So like I can talk about this forever and I won't. It is important to have, all kinds of people participate in research because different treatments work differently.
Absolutely. You hit the nail on the head. And I'm going to end this with each of you giving us just a few final words that you want to get out there. What's the message you want, the takeaway? We know you guys aren't wordless. Giselle, do you want to start?
Sure. Is this like takeaway based on like what
from the discussion today? What do you want people who are watching this to walk away knowing, and maybe a call to action?
I feel like I would be remiss if I didn't say go vote. Absolutely 100% November 3rd, get out there and vote. Or vote by mail, however you can, just make sure that you vote. A lot of the things that we've been talking about absolutely have been around for a really long time, like structural racism. But the pandemic is relatively new. And as I mentioned, the way that we went about dealing with it wasn't the best. So, we might not have to have had this Zoom session if in February, things would have been a little different. So go out there and vote, exercise your right to vote, but also know that healthcare providers and community workers and medical students and everyone are trying our best to help the community, because this is something that we actually really care about.
Okay. Mario.
She said it all. I would say, I'll repeat what I said before. We all have the power to make a difference in our community and our lives, and we should be very cognizant of that, especially now that it's so relevant. So whatever you do, whether it's in your family, at your job, or a social club that you belong to, a board that you belong to, put it into context. Think about the Black Lives Matter movement, and think about how you can make a difference. Don't just accept the status quo. And I know it's easier said than done. It takes a lot of courage, and it takes stamina and persistence, because things are not going to change in one day. It's going to take a long time. So you have to have patience and continue forward. So that's my tidbit.
Rosa.
I would add to the exercising your civic duty to just exercise whatever amount of privilege you have. Like if you're on your computer right now watching this, you have access to technology and Wi-Fi and a million other things that probably the people hardest hit don't. So find a way to use your power and your privilege and accessibility to help people who don't, either by volunteering or by donating. That could be money, or that could be supplies, masks, making masks. You know, there's a million and one ways to assist and to help better people's conditions of survival during the pandemic. And so, yeah, just considering what's within your capacity to do so. I think we all have our hand in it.
Excellent, excellent. Leslie?
Just like everyone said too, is like education, getting the word out there. And like I said too, with the 3 W's, wash your hands, wear your mask, and watch your distance. We have to do this together, and it takes one person to spread this devastating virus. So if we can all work together and educate one another, we can start to make more improvements, which we have been. It's just getting to that point. But
Okay, and Dr. Martins?
All I can say is that I don't have much more to say beyond what each of the panelists have already suggested. I love each idea. And the one thing that I struggle with my public health nursing students is balancing between those micro individual activities that we can do and those more macro structural things that we can do. And at that macro level, we're saying, well, get out there and help people get housing and help them to get their food. You know, see if you can help them in terms of finding jobs, working at that more macro level in general. But what I've been hearing from people is they would like just one person to reach out to them one-on-one. People are feeling lonely. They're feeling isolated. Depression is up. Opioid overdoses are up. Gunshot incidences are up. So maybe if we can even if we can reach out to one other person, one neighbor, one person in the street, whatever it might be, that those individual encounters also could be beneficial.
Well, that was excellent. I want to thank all of our panelists, Dr. Diane Martins, you just saw, Giselle Bello, Leslie Montague, Rosa Sierra, and Mario Bueno. A lot of insight today, and I really apologize that I'm on a gray screen or whatever. I feel like I'm in radio right now. But I think there's a lot of takeaways. You know, it is not a political health issue. It is a public health issue. Yes, we need to exercise our right to vote. Yes, we need to do the research. We need to look into what is fact and what is fiction. We all, most of us, no matter where we live, have access to social media and can do this. So I invite you all to take a deeper dive into what was said tonight and to really think about what was said tonight. It's some really good insight. I think our panelists were amazing, of course. And I want to thank you for tuning into An Injustice for All, how COVID-19 exposes disparities in healthcare. Have a great night.
Thank you.
Thank you so much.
Thank Barbara.
Thank you.
Thank you, Barbara. Thank you, everyone.
Thank you.
Yeah.
Bye. Hope to see you one day soon.
Yes.